Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Amir Atabeygi. He's a family physician, and we're going to talk about the Kevin MD article that he co-wrote, Building Trust in Dyad Leadership's Partnerships. Amir, welcome to the show.
Good morning. Thanks for having me on.
All right, let's start by briefly sharing your story and jump right into the article that you co-wrote.
Oh, sure. I work at a critical access hospital in Elma, Washington, and I'm the medical director of two of our outpatient clinics with my partner, Christina Mitchell, who couldn't join us. And she and I wrote this article about dyad relationships. I think mostly it was my idea, and she jumped in with me because we have a great working relationship, but I've also seen what the other side looks like when you're under the leadership of dyads that are not so high functioning. And I think there's no training for this. If you when you take on these leadership roles, you just get thrown in and you kind of have to figure it out. So it's nice to have a little bit of a framework to go by.
All right. So, for those who aren't familiar with clinician administrative partnerships, I know Dyads is one version of that. Let's bring everyone to the same page and
Mhm.
explain what a dyad partnership is.
Oh, sure. So generally, a dyad would be a partnership between a clinician and an administrator, and you co-lead a clinic or a service line. And so I'm the clinician in our partnership, and Christina is more administrative, operational. And I think the point of a dyad is that you each bring unique skills to the job and sort of co-lead together and highlight your strengths and fill in each other's weaknesses.
All right.
That's what the model is supposed to be, anyways.
So tell us how those responsibilities are shared between you two.
Well, we originally started off as dyad partners for one clinic and then took over another clinic, as so happens in rural healthcare. You just do a lot of things at the same time. But very early on, I think we delineated our roles in that anything that was clinical related, I would take care of, and anything that was more admin related, she would take care of. And there's always things where it involves both aspects. And we started just having a great relationship in that we would communicate those things and make shared decisions together. And part of that was we trusted each other in our competence and information sharing, and that made it real easy because we never had to think what the other one was doing. We always knew what we were doing.
So it sounds like, of course, communication between you two is critical to a successful relationship.
Mhm.
So can you share an example or story where that dyad framework, that successful dyad framework in your case, overcame a problem or obstacle, just so we can see what it looks like in practice?
Sure, I have a great example. We, as part of our expansion of our services in hospital, stood up a sleep lab and an outpatient sleep clinic. And there was some staff turnover, and Christina ended up having to be part of that, even though it's not part of her regular work. And I think this comes down to communication and trusting each other because she was doing this work and I was not part of it. It was a totally different service line, and she was just helping. But I go by office and she'd seem really frustrated and really into it and couldn't figure it out. And one day I just said, "What are you working on?" And she's working on the sleep lab. She wasn't sure how the billing would work or how where the results would go in the chart that's best viewed by the clinicians because we'd never done it before and not a lot of institutional experience. And so I was curious and she told me this and I walked in and we sat, she told me what she needed and we figured it out, I think in 20 or 30 minutes, what she'd been working on for days. And that's been our system ever since. And just that kind of curiosity and trusting each other in our areas of expertise and just communicating, being curious. What are you working on? What are you doing? And I peripherally knew she was working on that, but I didn't know the details. And once she
Mhm.
filled me in, we figured it out together.
I talked to a lot of physicians on this podcast, and a lot of physicians write on Kevin MD, of course. And sometimes there's an adversarial relationship between
Right.
clinicians and administrations. I hear you use the word trust and communication a lot. So, how do you build that trust? How do you build those open lines of communication between your administrative partner?
I think it has to be very intentional and right from the start. I think if you've never been in a dyad, you should almost have a dyad charter, if you will, and write down what each person's role is, who's responsible for what kinds of decisions, and what decisions are kind of co-managed, and just some clear expectations. But the trust part, I think, just comes over time. You
Hmm.
have to trust each other to follow through. And I think over time, if you do things that you say you're going to do and you get results, or if you ask for help, I mean, no one's going to know how to do everything perfectly, but that's the other part of the communicating is you stay open with each other and say, I don't know how to do this, or I need help with this project. And one, that's communication. Two, that builds trust because you know the other person will come to you if they need something. And I think dyad relationships that are adversarial fall into this pitfall of thinking they're each doing a job when dyad is two people doing one job. And so you should think of it as you're sharing this job. Which parts of it are you responsible for? And which part of it are you responsible for jointly? And so, you consider writing that down if either of you has been in a dyad or things seem to be having some friction, just making the roles clear can be very helpful.
How common is that dyad framework when it comes to various clinic offices? Is that the pervasive leadership framework
Mhm.
today?
That's been my experience. I've been with three large healthcare organizations over the years, and that's been the model that's been in place in all of them. So it's quite common.
And you've seen some relationships earlier on don't work. Give us some examples. And of course, you don't have to name names, but what would
Mhm.
a dysfunctional dyad relationship between a clinician and an administrator look like?
I think the biggest thing comes down to the one partner doesn't know what the other one is doing or the decisions they've made. And depending on who you talk to, you get different answers. And one of the big things Christina and I focus on is we're both on the same page. No matter who you talk to, you'll get the same answer if you have a question, because that's how we've just been together in our dyad relationship. But it causes chaos when you have a leadership team and one gives you a different answer and the other one gives you a different answer. And so people sometimes, just like small kids and their parents, they'll pick and choose who they go ask things for depending on what they want. And that's where mistakes happen or miscommunication happens and people get different messages. And so I think that's probably the most common thing where you see friction from is unclear expectations and just not communicating or getting a clear message from your leadership team.
And of course, in that scenario, when you have that dysfunction and friction and poor communication, that spreads downwards and affects the morale of the entire staff, right?
It does, but information obviously flows downwards. So one person comes talk to you and someone else talks to the other partner, and then information flows down from there in two different paths. And suddenly you have half your clinic doing one thing and half doing the other thing, and everyone is confused and doesn't know what the right answer is. And so that affects the people and your clinic operations. And then ultimately, though, it comes back on you because now you have to fix the problem. And so you've really just made more work for yourself.
Now, you said that there wasn't any playbook for physicians to step into these leadership roles, let alone a dyad role. So, for those physicians who are entering this position for the very first time, just based on your experience, what are some tips that you have for these physicians?
So it depends on your dyad partner. If you and your dyad partner are both new to the role, that could be, I think, maybe a good thing. You don't have any preconceived notions or bad habits. If your partner that you're starting with is more experienced, that could be something to lean on. But when you start off, I think, like I was saying, you should have clear roles and even consider writing them down for each other. And that way, I think the expectations are clear. And once you get clear expectations and even write down, like, we're going to meet 1 hour a week on this day, and that's our set meeting day, but it's written down. So you have something to reference. And that kind of thing, I think, just clarifies your role and make things a lot easier. And you just go from there. It's building steps. And the first step is what is your role? What are you going to do from day to day? How often are we going to meet? What is our, deliverables? What are our metrics that we're responsible for that we want to work on? And just having, I think, two or three things to work on in your role in your clinic, leadership board, wherever you are. That kind of will narrows down your scope at the beginning. And when you get small victories, you can build on that. Whereas if you come into this kind of work and you say, I'm going to fix this entire clinic,
Hmm.
and that's you can't, that's not realistic. You can't just start off from there. So small goals, clear roles, and just writing down expectations can be a great way to start.
So give us an example of how you interact with your diet partner, Christina, and what's your typical day like, and how do you balance that with what you do clinically? How
Mhm.
often do you interact with her? Do you have set meetings several times a week? So just go into more detail in terms of how often you interact with your diet partner.
Well, when we started off, it was easier. We managed one clinic, and so we shared an office, and we would talk daily. And so we managed a urgent care clinic at the beginning. And after that, we also took over a walk-in primary care slash medication assisted treatment slash behavioral health
Hmm.
clinic. And so she spends a lot of her time at that clinic, and I spend a lot of time in the urgent care clinic. That's where I do my clinical work. And we have set meetings every week where we'll meet for 30 to 60 minutes
Hmm.
and just review what's been going on and what we're working on. But also just informally, we call them catch up sessions where she'll come to my office or I'll go to hers and we'll just sit maybe 15, 20 minutes and just go over things that have happened in the last few days. And then there's the normal things, text or talking on Microsoft Teams, which is always, I think, great for everyone who uses
Hmm.
it. But I think people have come to expect that we are sort of like one person.
Hmm.
When she goes to meetings that I don't get invited to, she'll ask them if I can go. And if they say no, like it doesn't matter. I'm going to tell them everything anyways. And she'll tell everyone knows this by now. And so I think there's an expectation that whatever I know and she knows, the other person knows.
Hmm.
And so we were very intentional about that. But at least for sure, once a week we meet. But practically speaking, it's almost every day or every other day.
Now, is there any confusion among the staff in case they have an issue or if they want to give feedback in terms of who to turn to? Because
Mhm.
there are obviously two leaders in the clinic.
There can be. I think that comes down to clarifying your roles. And so if someone comes to me with a question that is more her expertise, I'll say you should talk to Christina about that. She'll give you the right answer. And we each know our role and we each know what we're good at and what are not our strengths. And that's very helpful. And it's open. She's the first one to say, I'm not clinical. I don't know this.
Hmm.
And then tell me about it. Or the other way around. And I'll say, I don't know how to do this. Like, can you help me? And that kind of openness really makes it easy because just your job gets a lot easier. I think the hard part about dyads is the upfront, if there's friction, that makes your day-to-day work hard, but also just makes more work for you
Hmm.
having to fix problems down the road or things of that nature. So we're having clear roles has been the biggest thing because we just tell people you should talk to Christine about that, or she'll tell you you should talk to Amir about that.
How long does it normally take for a diet relationship to kind of hit all the gears and feel comfortable?
Well, I'd say that depends. If you've been with an organization for a long time and you move into a leadership role, I think there's less catching up because you just know how the organization works. So it could be maybe even a month or two.
Hmm.
If you're joining a new organization, probably 3 or 4 months, I think, just to know the ins and out of how the organization works, who the people are, and just how to get established. That sounds about right.
We're talking to Amir Atabeygi. He's a family physician. Today's Kevin MD article is Building Trust in Dyad Leadership Partnerships. Amir, let's end with some take home messages that you want to leave with the Kevin MD audience.
Being part of a great dyad relationship makes the work very easy. And if you're going to do that kind of work, invest the time up front to set up a great relationship. It doesn't just happen by accident. It's intentional. You have to make it happen. And so having these clear roles and just expecting good communication and just being open with your dyad partner can really make things smooth. And then once the leadership team is working smoothly, the clinic will just kind of work smoothly after that because people will see you working together. And then, as you set an example for the clinic or whoever you're managing, it just kind of flows down, even unintentionally. They just see you doing it. And so that kind of modeling can be great. And if you're unlucky enough to experience a bad dyad relationship that's leading you, then, and it's frustrating as it was for me, consider getting into that kind of work. And what do they say is be the change you want to see.
Mhm.
And so it doesn't have to be friction. It doesn't have to be hard. It takes work up front, but I think it's worth it.
Amir, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thanks for having me on. I appreciate it.